Hello, and welcome to Healthy Living. I'm Dr. Donald Pelto. Today we're going to talk about Achilles tendinitis. So you can see here from this first slide, the Achilles tendon is an area in the back heel where people have different types of pain that can happen. Basically, Achilles tendinitis, there can be a couple of areas we're going to go over where it can happen, but if you have this condition or you've had the condition in the past, you're going to know what we're talking about. We'll first talk a little bit about what causes Achilles tendinitis. Usually it happens because people do increased amount of walking or running. Typically I see people that they start walking or running on a treadmill, especially people that start using an incline. They go up on an incline on the treadmill. That puts a lot more strain on the Achilles tendon or on the back heel region. People as well that they change their shoes or the surface. Specifically for the shoes, what I find are people that go from a shoe that has a heel lift on it, such as a high heel, and then they go into a flat that has no heel on it. That puts extra strain and pressure on the back heel. Different surfaces can affect it. For example, if you work or get a new job on a hard surface, such as a concrete surface in your walk, standing period, that can cause Achilles tendinitis. Weight increase, increased weight or pressure through the back of the Achilles. I sometimes find that females that become pregnant and they have a lot more weight on their feet, and then maybe they have the combination of the increased swelling in their feet, so they can't wear their normal supportive shoes and they're having to wear unsupportive shoe, along with increased weight, sometimes cause some Achilles tendinitis. People that start working out, especially people that do more of a propulsive type of activity, they're pushing weights up using their calves or working on their legs, or they're doing sprints or different types of activities. And then we talked about the lack of support of the shoe, or even a lack of support of the foot if you have a very flat cause Achilles tendinitis. So those are some of the more common things that we see with Achilles tendinitis. Specifically with the anatomy, I want to show you that the picture, on the upper left-hand corner there, you can see there's little tears that happen in the Achilles tendon region. Those little tears, those little micro tears, can happen at an area that's above the insertion. You can see the picture underneath that one. There's an area where it says zone of tendinosis or tendinitis, and in that area is where there's thickening in the area of the plantar fascia. Of the Achilles tendon region, and that can become thickened and become problematic. The picture on the upper right-hand side, what you can see is that the area of the gastroc and the soleus, where they come together, they come to form the Achilles tendon. And there's another type of Achilles tendinitis that's called insertional Achilles tendinitis, and that's the picture on the bottom right-hand corner, where you can see where it's inserting into the back of the heel, and there's an area of inflammation. So we want to make this difference. There's one type of Achilles tendon pain that's above the insertion, and there's another type of Achilles tendon pain that's right at the insertion of the bone. They're totally different. The area that people tend to get an Achilles tendon rupture is the one that's above. And the one where it's inserting into the back of the heel is more commonly caused by a repetitive strain, even a heel spur that can happen in the back of the heel region. What are the diagnostic exams that your doctor might do if you have Achilles tendinitis? The most common one is seen in the upper picture there, where there's X-ray. And you can see in this picture there's a bone spur that's shown in the back of the heel region. What is a bone spur? Basically, a bone spur is a deposit of bone going in a direction. You see how that direction kind of goes up at the area of the back of the heel. So what we see, there's a specific law called Wolff's Law, and when you have a tendon pulling on the back of a bone, for example, you have the back of the bone and the tendon is pulling, if it pulls for a long enough period of time, your bone's going to grow in that direction. It's going to create the spur in the direction of the pulling of the tendon. So on that picture, you can see that the spur goes upward right where the Achilles tendon inserts, and it pulls up and it creates that spur in that direction. In the picture in the bottom left-hand side, you can see that there's that widening of the tendon, and there's an area of black right in the center. That area of the black shows an area of a tear or inflammation. This is an ultrasound view, but you can also see the widening of the tendon. So if you remember that other picture that we showed you where there's widening or thickening, this one right here, there is thickening of the tendon, and this is an example on the bottom here of the thickening. the tendon normally is uniformly wide like this, but occasionally when there's a little bit of a tear, a micro tear, it kind of looks like this. So it kind of gets thickened in there. And specifically on the bottom right-hand corner, you can see a picture of an MRI. Some people need an MRI, and if we look kind of a little bit closer into that MRI image where that arrow is, you can see that the area of the arrow shows an area of whiteness in the Achilles tendon region. So there's that small little arrow, and then there's that area of whiteness within the tendon. A tendon normally on this MRI image should be black, and when you see that white infiltration, that would be an area of inflammation, could be tear, could be tendinitis, could be other types of things that are happening with that MRI. So how do you determine what diagnostic exam you need for your Achilles tendinitis? We start with an x-ray, and then based on the x-ray, what I say is if we see a spur, that gives us some information. If there's no spur, that really doesn't help much, because if you have 100 people with Achilles tendinitis, 50 will have spurs, and then 50 won't have spurs. So that's kind of the issue. The spur isn't always indicative. Sometimes that spur can be broken off. Sometimes it can show that there's other issues going on. The ultrasound, I like an ultrasound because it shows me the soft tissue, and it's easy to do in the office. So you put the ultrasound on the area, it'll show you the spur, but it will also show you any area of inflammation. And then if things really aren't getting better after some treatment, or if you're concerned that someone might have a rupture of the Achilles MRI, show what's going on. So those are, the diagnostic exams. There are some also physical exams by basically just pushing on the Achilles. Remember that area where it's thickened? If you take that thickened area and squeeze it, it's going to be painful. Also, if you take that area, let's say that this is the back of the heel where it inserts, and you push on that area, depending on where it's going to hurt, that can indicate there's an area of Achilles tendinitis, that insertional Achilles tendinitis. There's this little treatment evaluator. Basically, it's just a little checklist that I put together that talks about the different types of treatments for Achilles tendinitis. And the reason I put this together is because people a lot of times aren't sure what's the best type of treatment for their condition. And you can look at this. It's going to go over some of the other things that we're going to go over. But basically, you want to look at and try to do what's the most effective and try to avoid what's the least effective type of treatment for your Achilles tendinitis. I'm going to give you a little link later on that you can download this. It's in a little booklet format that you can look at this with greater depth if you'd like PDF. It's kind of small to see. But let's go over and talk about the treatment areas. When we looked at this list, I just want to highlight on the top of the list, you can see that you have a category called reducing inflammation, another one that says reducing tightness, and then another one that says stabilizing the foot and reducing pressure in the gray up on top. And I like to simplify treatments based on those categories. So we'll first start at looking at ways you can reduce the inflammation. One of the first ways and most beneficial ways now is something called Shockwave or EPAT therapy. This little thing that looks like a gun. If you notice inside the gun, there's a little thing that looks like a bullet, and that little bullet there is moving back and forth, and it's hitting against that metallic piece in the front. When that bullet goes back and forth, there's a ballistic or a pressure that's going to go back and forth, and that's going to create a sound wave or a shock wave, call it. And that area of shock wave penetrates to different surfaces based on what type of tissue that you're using. It also is based on the diameter of the metal tip on it. So the bigger the tip, it's a bigger surface area. The smaller tip, smaller surface area, so it penetrates more. And this is a way that we actually injure the area to reduce the inflammation. Basically, the way it works is you hit the back of the Achilles tendon, whether it be the area of the thickening or as it inserts into the back of the heel. That causes injury, increases the good blood flow to the area, and that helps bring healing. The way we use Shockwave in our office is usually a series of 3 treatments, and they are a week apart. And then after those 3, then you give it a 6-week break until to see how things are doing. And for a lot of our patients, this is a way of treating Achilles tendinitis, and it's very safe. There's really no side effects whatsoever with this type of treatment. And we find it most beneficial at the ones that there's thickening. Remember the one that there's thickening of the Achilles tendon? That works best. The ones that are insertional into the back of the heel, in my opinion, it doesn't quite work as well, but there's really not many other things that work really well for that. In terms of reducing inflammation, you can also take anti-inflammatories. Motrin, ibuprofen, any other type of anti-inflammatory can be beneficial. I find if it's not working after a couple of weeks, you may need more treatment in conjunction with the anti-inflammatory. Also, icing can be beneficial. You can see here this person put their Achilles tendon up on this binder with an ice bottle right there, and that's rolling the ice area. You can just take a cup, styrofoam cup a lot of times and fill it with water, that image in the bottom left, and then you pull around the styrofoam or the paper around the area, and that will be applied right in the area of the Achilles tendon. And then the last picture on the bottom right-hand corner is something called contrast bath. If you haven't tried that, it worked very well. I kind of equate it to resetting the computer at home. If you reset it, it fixes a lot of things. So what you do with the contrast bath is you always start and you end in the ice water. You put your foot in the ice water for 5 minutes, then you put it in hot water, which is the basin on the side, and then you put it back in ice water. So it's 5 minutes, 5 minutes, and 5 minutes. That's another way of icing to reduce inflammation in the back. I'm including this little needle in this injection here, not because I do a lot of injections into the Achilles tendon. Frankly, we do not do cortisone injections into the Achilles tendon except for some certain reasons. For example, if there's a bursa that's isolated and it's away from the Achilles tendon. You don't want to inject directly into the Achilles because it can cause a rupture. Occasionally with ultrasound guidance, if there's an area of inflammation or a bursa, we can inject that area. Then we usually recommend putting people into a walk boot or something like a ski boot to help reduce the inflammation, help reduce it and protect the area of the Achilles. Once again, not recommended to do cortisone injection into the area of the Achilles. There are some other injections that we can talk about later, such as platelet-rich plasma or amnio injections in that area. The next category is reducing the tightness. I want to explain that the gastroc and the soleus are the two muscles that come down and they make up the Achilles tendon. And if the Achilles is tight, it's very hard to loosen up a tendon itself. You look at the tendon, it looks white. Okay? The Achilles tendon is white. The gastroc and the soleus are red on this picture because they have more muscle, they have more fibers. And the reason you reduce the tightness in the gastroc and the soleus is because they stretch. Basically, by loosening them up, it's going to reduce the pull on the Achilles tendon. And specifically, how you reduce the tightness, I recommend and I refer very frequently in my clinic to a physical therapist that does the Graston. The Graston technique, as you can notice here, is a piece of metal. They use the Graston tool to rub and rub the Achilles tendon and also the muscle segment above it to reduce the tightness in that area. And that can reduce the pull on the Achilles. You also have to evaluate other areas and kind of looking up the chain of your body. You have tight quads, you have a quite tight IT band. You also have core instability that can put more strain to the Achilles. There's a lot of other reasons, and the physical therapist is going to look at that. They're going to look at mobility and other things that can cause problems with the Achilles in that region. Specifically, I recommend some home therapy. The physical therapy is probably going to be twice a week, maybe 3 times a week when you're starting out, but you need something to do every day. So here are some tools that we recommend. They're called trigger point tools. Here's a couple. There's a couple of other newer ones that are out there. But the upper left-hand picture is someone using a yoga block with a ball to really penetrate deep into the area of the Achilles tendon. There are different types of exercises that you can learn how to do that. Foam roller is the one that you see in the center, and that foam roller is used on the back of the Achilles region to loosen it. It doesn't penetrate as deep, but for a lot of people it works well to have them mobilize the Achilles tendon. And that can also be used for quads, on your ITs, on other parts. And then finally on the right-hand corner there's a stick. This is a stick that's used to roll, loosen up the area. These are things that are done at home. As you notice, we're not talking as much about stretching. I find stretching can be used if people do it correctly, and I'll give you a couple of stretching techniques. But I find people usually, before they come and see us, they've already tried stretching, so there are some other things that are better for you. One of the best stretches could be the runner stretch. If it's done correctly, you want to ask your doctor or your physical therapist to teach you how to do that the right way, and also the stair stretch where you put your heel going downward on the stairs. But be careful not to overdo it. Sometimes this can actually strain or cause more injury. I don't like stretching as much unless you don't have access to physical therapy or any of those tools. Another thing that a lot of times is a problematic for people that have Achilles tendonitis is they have pain when they either get up sitting for a period of time or they get up in the morning. And there are a couple of options to reduce the tightness in the Achilles. One is the splint that's seen on the upper picture. That's called a night splint. It can be that's a posterior night splint, which is on the back of the heel region. There's also one that can be in the front of the heel region. This is made if you have pain when you get out of bed. It's beneficial, but if you have a foam roller or one of these other treatment tools, you could also use that first bed. Another thing that sometimes you can do is that picture on the bottom, you can see that person stretching the Achilles with a towel. That's very effective for just stretching it for 30 seconds or a minute before you get out of bed or before you get up from sitting down. Both of those are effective, but I really find that the foam rolling and the physical therapy and these others are more beneficial. And that night splint can be very cumbersome to wear at night. Most people can't last wearing it all night, so you have to take it off. Another thing that can help you with reducing the tightness is a heel lift. If you look at this picture, there's 3 levels on this heel lift. Each of them are a little bit, and they're added up together. And this is an adjustable heel lift, so you take piece by piece off. So you start out with the big heel lift, and then it reduces over time as your symptoms get better. And if you look in the picture on the bottom, you can see the picture on the left is a normal Achilles tendon. You can see the red line indicates the length of the Achilles tendon. And the picture on the right shows that that length has reduced when you put that heel lift under that area. So for a short period of time, a heel lift can be beneficial for your symptoms because it lifts up the heel. That's why a lot of people with Achilles tendinitis and also people with plantar fasciitis, they feel better with a shoe with a heel, like a high heel shoe, temporarily. But you don't want to wear a heel long term because, as you can imagine, if your Achilles tendon is shortened for a long period of time, it's going to stay that way. When you shorten or you don't use tendon for a long time, it's going to shorten the size. So a heel lift can be beneficial. Once again, not recommended to use it for a long time. Next, we're going to talk about stabilizing the foot and reducing pressure. We want to reduce the pressure and pull on the Achilles and also stabilize your foot. These are for people that have a very flat foot. For example, there can be a lot more strain through the area of the Achilles. Also, basically, a lot of our patients that come into the office, they don't have the best footwear. They might be wearing a lot of flip-flops, they might be sandals, or just these shoes that don't offer any support. I find that people with Achilles tendinitis, they tend to feel better with a shoe that's more supportive. There are a couple of brands like Icing or a New Balance. You want to get a good, stable shoe. Go to a shoe store where they're going to watch you walk. It's indicated for that. Another thing you want to look at, heel height, because some people, they're wearing a lot of these minimalist shoes. For example, you go from a heel that is this big in your running shoes and you go to one of these new minimalist shoes that has no height to the heel, that's going to put more pressure on the Achilles tendon and you may actually have more pain with it. You have to be aware if you're wearing a lot of flats or if you're doing a lot of walking. Typically, I hear people about, they go to Disney and they wear flip-flop for 2 days in a row and then they get a, or they go on vacation to a big city, and they're wearing these cute little flats and then they walk for miles and miles and then they get a, these are more overused things. So if you are trying to recover, wear a good supportive shoe. One I don't have on here are a Dansko. Some Dansko. Some of my patients, if they have a lot of pronation or flattening in their foot, you can see the picture on the upper right-hand corner is a person that flattens it in. You can see the picture there before and after orthotics. The main reason for using an orthotic for this condition, for many of the conditions, is to straighten the heel position. See the upper right-hand corner there, the line that's drawn, it shows that everything's collapsing in, and then afterwards everything is straight. You can see the picture underneath there, the collapsing in of that bone model, and how it lifts it up. So basically you want to take someone that flattens in. So if you watch someone walk from the back and you see that everything is collapsing in, an orthotic a lot of times for them is helpful to help stabilize. Another way to help stabilize the foot, these are temporary things, these aren't made for everyone, but there are braces that people can wear. There's a picture of that brace on the upper left-hand corner. That brace can help stabilize the ankle if there is an instability of the ankle. The walking boot that you see upper right-hand corner, there's two of them, two walking boots. A walking boot can be helpful temporarily with Achilles tendinitis to reduce the pull on the Achilles tendon. Not everyone uses these. These aren't necessary for everyone, but for some people it can help. And then also just rest. See the feet up there, resting it. It's hard. I find that people today, they're very busy. And if someone comes in with a chronic tendon injury, they don't have the time to recover. And so sometimes I have to be the bad guy and I have to put them in a walking boot to make it because everyone's just so busy. And that area, specifically on the back of Achilles, doesn't have the best blood flow to the area. So that's where a lot of these other treatments are used to help reduce the inflammation. And we do have some advanced treatments, so Achilles tendinitis advanced treatments. We talked about the one in the upper right-hand corner, that's the Shockwave for EPAT. That's really much my first line of treatment. If someone's not getting better with resting, with icing, anti-inflammatories, then I'll jump to Shockwave. One thing you have to realize, though, you can't use Shockwave if you're taking anti-inflammatory, or even if you have a cortisone injection, specifically in that area, because they work against each other. The whole idea of injuring it with Shockwave is going to increase good blood flow to the area, and an anti-inflammatory reduces those inflammatory cells. Another newer treatment is something called an amnio injection. This picture shows an injection. It's not a specific area that you give it. This is one of the healthy areas healthy types of things you can inject in there. Amnio or amniotic cells are basically, you take the cells from a mother that gives birth. The amniotic cells that are in there, they're very healthy, they're sterilized, and then they are injected because they have very high levels of different types of chemicals and things like that help reduce inflammation. They're very potent anti-inflammatories that are natural. And they're injected right into the area of the Achilles tendon where it's injured, whether it be at the insertion or slightly above. That's usually done with ultrasound guidance, and it's very effective for down-regulating the inflammatory cells. Platelet-rich plasma is the picture below. Platelet-rich plasma is done where you take your own platelets and you spin them down in a centrifuge. You take about 10 milliliters and you try to get a certain portion of the platelets and you spin them down. You inject them into the area of maximum. Once again, the platelets are very good at reducing the inflammation area of the Achilles tendon. And then the last case is some people need surgery. I find surgery is more common for the Achilles tendon because of a bone spur. So if you have Achilles tendon due to a really big spur in the back or a bump, that's called a Haglund's deformity. We didn't really go into details talking about that, but that big bump in the back sometimes needs to be shaved down, and then you reattach the Achilles tendon to the back of the heel. That can be beneficial for resolving symptoms. So that's basically what we wanted to go over with this Achilles tendon treatment video. There is a little checklist I use. I'm just going to leave this up here for a second for people to look at it. Goes over basically the way I think about it, and I go over it with my patients. Imaging: did we get an X-ray? Do we need diagnostic ultrasound or an MRI? What are the traditional treatments reducing the inflammation with Shockwave, anti-inflammatories or prednisone, icing and contrast baths? How are you going to reduce the tightness? Physical therapy, home therapy, stretching, night splint, heel lift, and how are you going to stabilize the foot? Orthotics, walking boot, ankle brace, arch support, supportive shoes. I recommend you do one thing from each of those categories when you're being treated, and this is just kind of a checklist. Oh, we've tried this hasn't worked. And then finally, the advanced treatment you can see here: Shockwave therapy, amnio injections, PRP, surgery, or sometimes if things really aren't getting better, you may need to get a second opinion about what's going on. Because if things aren't getting better, sometimes you have to look outside the box to see what the solution is. And then finally, I just want to share with you a little booklet that I put together that you can download for free at my blog. It's drpelto.com. It's a little booklet. It's called A Healthy Living Guide to Achilles Tendinitis. It's really going to go over everything I went over in this video, but sometimes you can't remember everything we talked about, and you don't want to watch the whole video again. So if you want to download this PDF, you can download it. It's A Healthy Living Guide to Achilles Tendinitis. It's going to go over everything we went over here and some more information. So hope you found this helpful. Thank you so much. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see